Limpopo has the second lowest number of active COVID-19 cases in the country, with just over 1,600 cases at the moment. But this does not mean the province can be complacent with interprovincial travel open. How is it preparing to deal with the possible influx of cases? Let's chat now with Health MEC Phophi Ramathuba. MEC, good morning and thanks so much for your time. We are checking in with all the provinces today, especially in light of this number, the over 14,000 new COVID cases. It is the highest ever we've seen during this pandemic. How's Limpopo faring at the moment?
Morning, Yvette, and morning to all your viewers, and thank you for giving us this opportunity. Yes, indeed, as a province, we are, of course, worried by the number of visitors that are visiting our province. Either they are children or citizens of this province who are in other provinces for economic activities. If you realize what we saw yesterday, by 20 hours, we had more than 1,500 vehicles passing through our one of the toll gates. So what we are currently doing as the government, led by the Provincial Command Council, we are, like, for instance, in the next few hours, I will be at the Grand Scope together with the MEC for Community Safety and Transport, where we will be talking to motorists who are coming back to the province, screening them not only for COVID, even for other conditions, your diabetes, your hypertension, because elevated blood sugar and elevated blood pressure can at some time cause you to have blood vision and cause a road accident. So we will be doing that. But not only that, we are also moving around our malls so that we can check the compliance, the stores manager, because we are making a call to all captains of industry. Let's go back to even worse, more than what we used to do around June, July, that time, so that we should comply strictly, making sure customers that are inside the shop do not exceed the number that is required, depending on the size of your shop. You must always be sanitizing them and always be wearing their mask when they enter your store.
Well, MEC, it's great that you are doing that, especially at the tolls as well, and yes, in our shopping malls, because that's where people will be, especially today, those last-minute rushes. But let's talk about what's happening at the border post at the moment. And, you know, we've been hearing horror stories there, and I know that this is more a home affairs issue when it actually comes to those delays. But what's your understanding about what the hold-up is? Why is it such a complicated affair? We understand COVID screening has a big part to play, and that will fall under your umbrella. Why is COVID screening taking so long at the border post? Did nobody envisage that we are going to have these problems?
I think, Yvette, we need to be clear to say, yes, we knew that when we opened the border post, there would be such challenges, especially during this time, because even when we are not dealing with a pandemic like COVID, we always have got an increase in terms of traffic flow. However, you would remember that the National Department of Health published some regulations and requirements for you to pass the border post, to say you should come with your results that are not older than 72 hours. And of course, can even go on an app and do your own self-screening and do that, so that we can make sure that you don't delay at any border post. However, our people are not complying. Look, the queue, even yesterday, I was discussing with the team and also together with the minister. You know, that people are not complying. They leave as far as Cape Town without having done any single test, and then expect us to test them. Just because, as the Department of Health National, through the National Health Laboratory Services, we have put a mobile station to test those who could have delayed or have been having some challenges there and there. They are relying on that. Instead, that laboratory is now overwhelmed because it has to test each and every one, which is very wrong. So that is why you would have noticed that we had a discussion with the minister and the DG to say, let those who are going outside the province, because that laboratory services, we did not put it for those who are leaving the country, but for those who are coming when we will be requiring the results. But then, because people know that as they enter the other part of Zimbabwe, they will not be allowed access without results. They then are relying on South Africa to do the test. So what is going to happen, you might have noticed that the Minister of Home Affairs is always on top of this, together with our officials, we will make sure that today everyone will be allowed to pass without the results, because it does not necessarily affect us as South Africans. But today, when they go the other side, it's still going to be a challenge for them. So we are making a call. If you want to travel, make sure you've got all the documentation. Don't rely on our testing facility, because the screening, I can tell you, does not even have to take 2 minutes.
Yeah.
We've been screened every day. The problem is that results, people want to be tested at the border because they are told in South Africa it's cheaper, and we are also doing antigen tests. You can quickly pay and go, whereas on the other side, you can't afford it.
Well, MEC, and you know, there are some, and I'll admit there are people who haven't done what they're supposed to do, haven't done their screening and come with their test. But having had our reporter, Spaman Lagoge there, he's been in the queue, he's been sleeping over as well. There are some people who have been there for 5 days. Now, if this test is only valid for 72 hours, what do we do about that? Because that would expire by the time they actually get to that border post, to actually get there and get across. Better.
That's why we had a testing station at the border post. It was for in case there will be such challenges so that we can test. It was not meant to test each and everyone. But the problem now is that everybody is coming without result. Those are the ones who are blocking the queue, because they come without any documentation, and then we are forced to test them. Hence, I'm saying the leadership is taking a decision. National will be taking a decision to say, we don't need your results when you are leaving our country. We need your results when you come into the country. But people don't want to leave the country without results, because they know when they go on the other side, they will also not be allowed entry to the other. So if we don't get cooperation from our people, it's going to be very difficult for us to work with. Remember what we said earlier on, together, because Port Health, we are working under the guidance of the National Department of Health. When we started, we agreed to say, we know in January there will be a challenge on our side, because that's where we need the results. Hence, we started the preparation. You will see come January, there won't be only one laboratory at the Port Health. We're going to have quite a number of service providers who will be testing people who are coming into the country, because that is our problem. But people who are leaving the country are not necessarily our problem, but they are making their problem our problem.
But can we say that, MEC? I mean, is it not actually irresponsible of us to send people? You say, you know, you're not so concerned about people who are leaving the country, but when they come back, isn't it responsible? Aren't we all in this together? That to say that we are going to be sending people across without being tested, that's okay. We're only worried about when they come back. I just have a bit of a problem with that.
We have simply said everyone, for them to be allowed access to leave our border post, they must provide their 72-hour results. They are not doing that. They are coming for us to test them at the border post. And look what has happened. It has led us into the current challenges where some people are even dying on the queue. Now, we need to be responsible and make sure there is no queue on that border post. Now, we are currently being blamed on the problem that is not of our own making. We have put those systems, and we have anticipated that when they come back, it will be a problem. We must test them on our side. So what we are appealing to people is that bring your own results. We will still screen. Remember, we are screening everybody. We will screen everyone who is leaving the country. We will screen everybody who's entering the country, but you must enter the country with test results. That's not being irresponsible to say to people, bring your results to cross the border. But if you don't have the results, we'll screen you. You will still pass through. But on the other side, they will not allow you. Just like on the other side, they are allowing them to pass through without results. But when they come to us, we are going to do our part and test them. Right. Yes, I agree with you. We are in this together. Hence, from the beginning, we did not agree for anyone to leave the country without results. So this whole issue still goes back to us working together with you as media houses to make sure we enforce responsibility. The people must also at some time accept that the president was clear when he said it's in our hands. If people do not want to take some form of responsibility, we are not going to win on this, because whenever something wrong happens, yes, as government, we will be held responsible. But I am also saying at the same time, our people, if you don't want to see what is currently happening at the border post, comply with what we are asking you. If all of you had done your test, you will not even spend a lot of time at the border post. You will just be allowed to pass through.
I hear you, Minister. And what's being done, though, to help those who are in those queues and some of the, and for people who've been there for days? You yourself mentioned those 2 deaths that we've confirmed there in that long queue. We were hearing from people there's no provision for water, there's no ablution facilities. So seeing the situation as it is now, what's being done to sort of bring some relief for those who have to wait in those queues at this point?
I think we are led by the Minister of Home Affairs, Dr. Aaron Motsoaledi, to resolve this matter. And I can reassure you that all the sectors, departments are there currently, making sure that the whole, all these problems, because it's not only that. And of course, there are those allegations that people die because of whatever, which I don't want to enter into that, because from where I'm sitting, I was discussing with my head of forensic pathology, who we are doing postmortem. As soon as I get the proper results on those postmortem, I'll inform the minister, who will then communicate to you. But as it is for now, let me bring comfort to our people that government is there, all sector departments who are supposed to do what, they are there. From a health side, it's on the issue of testing and screening. We are going to make sure that we don't become an impediment. Everyone who is allowed to pass will be able to pass. And the Minister of Home Affairs, as I've indicated, he is attending to these matters.
All right, MEC, but, you know, I just have to wonder, should we not have done something a little earlier? Like we said, people have been waiting in queues for 5 days. The build-up started not just today. You know, today might be too little too late. So the lessons we've learned from this after what we've seen happening at the border post?
The lessons that we learned is that as South Africans, we are, of course, doing our best. And unfortunately, we then at times become victims of our own best. The fact that we decided to put a testing station as the health department through National Health Laboratory Services for those who would be having challenges, which we anticipated there would not be many, of not producing 72-hour results or results that could have been expired because people have been on the long trip from as far as Cape Town. We put that to be able to assist such. Unfortunately, because cost effective, we then become a victim on that because people are no longer complying. They are living wherever, communicating with each other, that don't worry, at Bay Bridge, there is a test, they will test you, you will get the results and you will leave. So we are learning our lessons to say, if anyone who comes without results, we're not going to test you because you should have tested where you're coming from. That laboratory must be utilized for what it's meant for those whose results might have expired for whatever, any other reason, or someone that could have been critical and requiring our attention. Because currently it appears as government did not plan, and government did plan. We are on the road every day to try to make sure that we mitigate for the challenges that we are facing today. The Minister of Police was also there like just 7 days ago at the border post also to make sure that things run smoothly. But unfortunately, this has happened in the manner which we did not think people will take advantage and say they will test at the border post.
I would imagine, though, that the cost effectiveness or having to pay for these tests would be a problem for many of those people in that queue, because as we've been hearing, MEC, is that the tests are now being, sort of saved, if I were to put it that way, for those who suspect they have COVID. It's hardly going to be for travellers. That was the word a couple of days ago. Should we then not just have maybe shut the border post, not allow this travel to happen at all?
At the same time, when you do that, what then happened to the very same people? Because when your economy crash, what then happened? You are still going to be faced with all difficulties. I always believe that we should not be always looking at the shortcut of solution. People must learn to take responsibility. And because most of these people who are crossing the border are truck drivers, and their companies are captains of industry. They do have resources can be able to support their drivers. And if all of us can work together on this, we will be able to do that. But If we just say, let's shut down the border post, it's the very same captains of industry who will be taking government to court, who will be complaining about government this and that. When are we saying we have done 1, 2, 3, 4, we expect government to do 1, 2, 3, 4? Always we start by saying, yes, government must do this. I know government has responsibility, but at the same time, what is our responsibility as individual citizens? Because you said clearly, we are in this together.
Well, it is certainly an unprecedented situation. You know, everyone trying to figure out how to deal with this. And just very quickly, MEC, this situation at the border post has been seen as one of those super spreader events. Now we know Limpopo seems to be coping well so far. You say you have it under control. You've got the second lowest number of infections as well. But how prepared are you for what's happening there at the moment to sort of upset that, possibly to get those numbers higher? That this situation at the border is going to significantly raise those numbers, possibly. How prepared are you for that then with your facilities?
Yes, of course, we have identified that area as one of the hotspots. Hence, you would see that the intensify of screening and testing of those people who are crossing the border, and also those who are coming in illegally through the river. You have seen some crossing through the boat. It has always been a warning sign for us to say, what are we going to do? So yes, indeed, all our facilities in the province, there's no single facility that doesn't have a dedicated COVID-19 ward for in case we require admissions. And also what we did was to make sure that during the time when between September and now in November, when we were not having a lot of new cases, when we were registering around 15 new cases within 24 hours, what we did was to make sure that we use that particular period to continue empowering our facilities so that even our level 1 hospitals, they've got high flow oxygen machines, and all those COVID-19 wards are fitted with a high flow oxygen points, and so that we can be able to say that even Musina Hospital, small as it is, with challenges of infrastructure, it should be able to deal with any cases that are happening. But on top of it, we said all our regional hospitals, they've got ICU units now that are dedicated to deal with COVID. Even our Pietersburg and Mankweng, we've seen Pietersburg Hospital, we are beginning to see some of the overflow to another ward in terms of COVID-19 patients. But if you look at our MDR facility that we launched some time earlier during the first wave, we've got 87 ICU beds that are there. Yesterday when I checked, we only had 3 patients admitted there. So in terms of resources, I must say, infrastructure, we will be able to cope. But however, I must also use this opportunity to say the current road accidents that are happening in our province, you have noted what Minister Mbalula has reported, Limpopo has increased. It is a headache for us. Our hospitals on N1, their general ICUs are full, including our private facilities. I was speaking to the manager for Limpopo and Mediclinic. They are full because of the trauma, road accidents. That is a challenge for us as a province. With this whole accident that is happening is a challenge. The second issue, which is another headache, is that despite COVID-19 as a burden of disease, there are also all these other sorts of ailments as a result of alcohol. Our staff, they're suffering from fatigue. They've never been on level 5 lockdown. They've been on duty up until today. So hence I'm saying it is time for us to work together towards making sure the public becomes responsible and take charge of their life and their health. Otherwise, if we don't do that, it doesn't matter how prepared we are, we will not win this battle. It's still the community, the public holds the higher card. Lastly, the president has said, stay at home, you will stay safe. And we are also saying the same as a province. If you stay at home, you're not going to get involved in an accident. You will not suffer from a drunken wound. You will not get infected with COVID. As such, you will make our life easier.